very good evening to all our viewers. Welcome to Health and Wellness on Bethany TV, which airs every Saturday from 8 p.m. to 9 p.m. And today being the 16th of September, guess what? We'll be discussing something that mothers are still struggling, and that is postpartum depression. But today we'll be discussing more about the care. We shall deeply explain more, but most importantly, we would want to discuss about the care that these mothers need. So tap your neighbor, tap your sister, tap your mother, a mother-to-be. This is the time to watch and learn something new. In the studios, I do have Dr. Nsenga Joseph, a gynecologist all the way from Bethany Women's Hospital here in Lozera. Welcome to the show.
Thank you very much. Good evening, viewers.
How has been your day?
It has been, as usual, busy.
A busy day.
Yes.
But welcome. Thank you for sparing some time and, making it a
welcome.
point to come at Bethany TV.
It's always a pleasure to be in this place.
So today we're talking about postpartum care.
That's right.
But before, would like to know, what is postpartum depression, or what is postpartum?
So postpartum, from the word post and partum, is that duration after delivery. Now that the baby has been delivered, what next? From that time when the baby has been delivered up to 6 weeks, that time is called a postpartum period.
Okay.
We'll have a medical term, we call it puerperium period, but for easy communication, let's call it post-delivery period. So from the time the baby is born,
Yes.
up to 6 weeks, that's the time we are concerned with, for reasons which we shall be discussing in the course of time.
Wow, thank you. That is beautiful. Now, what are there stages how the postpartum depression comes in?
Yeah, before you go to depression, I think people need to know the broad aspect,
of
postpartum packages.
Yes.
What do we have? Because depression or mental health is a small fraction, actually. I think the last time I was here, I confessed I've not seen anyone with depression for the time I've been practicing. So it's not as big as we may want it.
As we portray it.
Yes. So we have many things that we do when the mother is, we fear many things, actually. Lucky enough, majority of the mothers go through it without any incidents.
Okay.
For instance, we fear things like bleeding, excessive bleeding after delivery. That's why we are targeting in the first 1 hour when the mother has been, the baby has been delivered.
Yes.
Yeah, we want to monitor the mother closely because that's the time when excessive bleeding can be. Actually, the first 4 hours, if you don't do something, if you're not careful to observe this mother, they can have excessive bleeding and you lose them. So you have to monitor closely. You have to make sure you monitor what's coming out.
Okay.
You make sure that the vitals, the blood pressure, the pulse is okay. And also you make sure that the uterus, where the baby was, is getting back in shape. And also for any other causes of bleeding. So in the first few hours, that's what we are concerned with.
Okay.
Yes. Then, of course, when the mothers are fine, nowadays, we say that if you've delivered in a hospital, don't rush to go home.
Yes.
I know you've had a normal delivery. The next thing is like, when can I go home? No.
True. Anything
can happen in the first 24 hours. So we pray for mothers to stay in the hospital. We urge them to stay because of reasons that things can happen. For instance, some, especially new-time mothers, they may not know how to breastfeed their babies. Okay? And there's some things that come up that you may not anticipate before.
Very true.
Very few mothers can even develop high blood pressure after delivery.
Yeah.
When it has been normal throughout pregnancy, during labor and delivery, then after delivery, you discover they have high blood pressure.
Okay.
So because of such reasons, you need to be with the mother for hours, especially 24
even
hours,
days.
Even days sometimes. If it's a normal delivery, 24 hours. Those have undergone cesarean section, 3 days. Then after 3 days, you assess if they are fine, they go home on medication. So in the postpartum period, we have what we call packages.
Okay.
So we look at many things. One, we want to make sure the mother is breastfeeding where there's that bonding, baby and mother. Number two, we want to make sure that the mother does not get anemia. Anemia comes from excessive hemorrhage, blood loss.
Oh.
Yes, then also we fear malaria in that period.
Yes, true.
Because the mothers are vulnerable. We want to look at the nutritional status of this mother. They may be having deficiencies in some vitamins and they don't have enough breast milk.
True.
Yes, we want to know if the husband is supportive. Sometimes spouses are not there.
Very true.
So we want to know if this mother is psychologically. What's the mental status? That's where depression comes in. What we call maternal blues.
Okay.
So we want to look at all those things. So after, so that's why we give them what we call appointments.
Reviews.
Yes, when you're discharged from hospital and you're fine, you don't disappear. Come back after 6 days.
Yes.
We do an assessment. How is your blood pressure? How are you doing? How are you coping up with motherhood? Because some of them have sleepless nights.
They do.
Some of them have stress. So you have to assess the level of coping. Are they doing well? Is the partner supportive? Is the baby doing well? Do they have enough breast milk?
Okay.
Some mothers have complications after delivery.
Very true.
Infections, breast sores. So many things you have to assess and know the mother and the baby, are they doing well? So after that, that's a package. You have all this assessed, not just a postpartum depression.
Well, doctor, you've elaborated very well about incorporating spouses as well, because usually when mothers give birth, it's like it's now their duty to focus on the child and the baby, yet there is also a husband, a spouse to be included. Now you've talked about there are times where they remain in hospitals, especially there's natural and C-section.
Yes.
Are there different days that someone should know? Or it's according you assess as doctors?
Yeah, generally speaking, for those who have had a normal delivery, after 24 hours, if there are no incidents, if you assess and the mother is doing well, they are stable, you discharge. Those who have undergone cesarean section, we say 3 days. Yes, after 3 days, you make your assessment. If they are doing well, discharge on treatment. They go home. Yes.
What do you think causes high blood pressure after delivery?
As I told you before, the last time I was here, when we discussed high blood pressure, the cause is unknown.
Okay.
But of course, things like stress can cause it, things that we eat, and other factors that we may not know. But it's so rare to get high blood pressure after delivery.
Okay.
Yeah, so there are few who get it.
A few who get it.
There are sleepless nights, and those who get it is usually transient. Yeah, usually it's because of the situation they are in, the stress, lack of sleep. They're not eating well. So it's a temporary thing, and then it clears. Most of the times, you don't even give medication.
Very true.
Yeah, just give advice,
Counseling.
do this, get enough rest, let your partner be supportive. And then within 3 days, they call and say, I've checked and my pressure is okay.
Wow.
Yeah.
Well, if you've just joined us, this is Bethany TV for Health. My name is Dorothy, and in the studio, I do have Dr. Nsenga Joseph from Bethany Women's Hospital, our gynecologist. We are discussing about postpartum care. And today we want to elaborate more and more. As you joined us, we're talking about the packages that are in postpartum, care, and he has elaborated more and more. There is something that doctor wanted to tackle about, the breast milk. Nothing frustrates us the moment you've delivered your baby and you have no milk coming out. As doctors, how do you go about this? I believe it's one of the leading factors that, causes into depression for women.
Yes, of course, the thought that you're unable to breastfeed your baby because you don't have sufficient milk is so depressing. So usually we talk about the diet. What do you eat? What's your level of intake? What you drink? So we advise people on what to drink. But even then, if you do what we call nipple cleansing and stimulation just before you give birth. Such mothers who do that, they get milk before the baby is born. Okay. So cleansing of the nipples, we have what we call black stoppers. I don't know whether mothers know about that.
No, I don't
During
know about
pregnancy, majority of women, you discover that their nipples or the areola gets darker.
Oh, yes, true.
And so the nipples also get dark patches around it. So if you try to observe, you'll see some black particles in the nipple areas. Now, for mothers who are aggressive and they clean before, in the first, second trimester, sometimes they call you saying they see breast milk already coming. So I always ask them, have you tampered with the black stoppers? So tampering with black stoppers can initiate mixed milk production. And also, for those who are lucky enough to be able to get this information that cleaning the nipples a few days before you give birth will help the nipples or the breast milk to start coming early. So when they do it, they don't suffer with insufficient breast milk. So I always advise, in the last few days when you're 38, 39 weeks, you can start now cleaning your nipples and removing the black stoppers.
Wow.
So doing that may help when the baby is born, the milk should be available. For those who do it and still don't get milk, then we advise certain foodstuffs that can promote milk production. Okay. Also, if you get enough rest, you have enough support, you're not stressed, there's always that milk production. But also, I must mention this, some mothers think or believe they don't have sufficient milk.
Yes.
So what happens? They believe they don't have milk, so they quickly go to buy other formulas, replacement feeding, and then the baby has no time to even stimulate milk production, because the act of suckling alone can stimulate milk production. So that's one of the things we do. If we tell you, much as you think there is no milk, let the baby keep suckling. The more the baby tickles the nipples, the more the milk gets produced. And so eventually, after a few hours of trial, you express and you see milk being produced. Also, I should also mention this. You'll be surprised that people don't know this. People think that when you express the nipple, milk will be flowing. And many times babies are frustrated because there's poor attachment or poor latching on the nipple.
On the nipple, yes.
So if you're going to breastfeed the baby and the baby's gums are biting on the nipples, you're likely to get frustrated and you get sores on the nipples. So what we advise, when you're going to breastfeed, there should be correct positioning of the baby. When you're comfortable as a mother, and you make sure the baby is not biting on the nipples. Instead, the baby should be touching the areola area, and the nipple should be deep in the roof of the mouth. If that happens, there's going to be proper milk production, because we have what we call milk glands. They are not in the nipples. Okay. Nipples have small ducts. So where the milk is stored is under the areolar tissue, that black big area. So we need to train people how to do correct positioning and attachment. And if you do that very well, you will find that there's enough milk actually. Well,
now that's the role of a midwife.
Yes.
Because Bethany, I believe they have the best midwives there. But I think that should be now put in, what are these things that we go for when, you're going for checkups when you're pregnant? Antenatals. They should also show us how they should breastfeed. Yes. Bethany, we do it here.
We do it.
Bethany, we do it. So anytime we come through.
We have a session on breastfeeding and proper attachment and promoting breast milk production.
Well, now, doctor, I've discussed everything. What are those signs postpartum? The mother has no milk. The spouse is disappearing. Maybe the vagina is still bleeding. Frustration. What are those things that, now that you know they are this, but there must be other causes that are causing this?
Causing depression?
Depression, yes.
Yes, of course, that what we have mentioned, loss of sleep, when you have no support from the partner, and also sometimes when the baby is having excessive mood swings, crying, the baby is not getting well, and the baby is sick.
We term it colic, doctor.
They call it colic when the babies are crying, because you can't know why they are crying.
Why they are crying, yes.
You have breastfed, you've done everything, you change the diapers, but the baby is crying and you're frustrated, you don't know what to do. Then you get a little bit of depression. Yes. So usually it's transient, but sometimes it can be suicidal. So it's always good to look out for this. And if you are lucky enough and the mother opens up to you, they'll tell you they are frustrated. They have lost interest in everything. They feel like the baby is not theirs. They feel like throwing out the baby. So if you get those signs and you find the mother is not happy, they have maternal blues, please, it's always good for them to get a counselor, someone talk to them, to talk to the couple, and with good counseling, you can overcome postpartum depression.
Okay. Well, Dr. Nsenga is still with us in the studio. What are those cares that are provided when someone comes with these needs?
Yes, so during postpartum period, we have 3 reviews. The first review, we review you in the first 6 hours of delivery.
Okay, 6 hours of delivery.
Yes,
okay.
So actually we say maybe now because of overwork, volume load, sometimes we say 24 hours.
Yes.
But the midwife, the doctors are by your side to just monitor you to make sure everything is okay. There's no bleeding, everything's doing good. The baby's breastfeeding, there's attachment, there's bonding. So those first few hours are good. Now once you go home, you come back after 6 days. Now when you come after 6 days, usually we do vital assessment. We do mental assessment. We do a thorough check, thorough examination to make sure that you're not bleeding excessively, the uterus is getting back in shape, you're getting back in shape. And also we advise to start what we call, I don't know whether you've had Kegel exercise.
Yes.
Yeah, because those have had vaginal deliveries, many things go wrong. the muscles get torn, the elastics are lost. So we advise you on what to do to get back in shape, so that you prepare yourself for your defend your family, because you know, family goes on, life goes on. You don't lose everything because you've given birth. You need to go back in shape. So now when you come back at 6 weeks, which is the third review, we focus on the general situation, but importantly, we discuss family planning. Yes, we give you available options for a breastfeeding mother, then you make a choice. Also, something that people are forgetting, which is very crucial, we want to do what we call cervical cancer screening around that time. Because around that time, it's the best time to check. The mother is back in shape, everything is okay. You have gone back in that state where you were before conception. So all that maternal weight is going away, the hormones are getting stable, and some people who are unlucky, their periods are resuming.
Yes.
So we want to discuss family plan, want to do cancer screening for you so that you don't get cervical cancer. I think we've discussed that before, that people who go for screening, they never get cervical cancer, because screening alone is enough to prevent somebody from getting cervical cancer. And of course, there's this question which comes up at that stage for most people at 6 weeks: when should they resume the marital obligations?
Yes.
And we always
That was my next question.
we always say that we should wait until 6 weeks. And that's why we discuss family planning at that stage.
Doctor, 6 weeks?
Yes, 6 weeks.
This is normal delivery or cervical? I mean,
cesarean.
Or cesarean.
Yes, it applies to both cases.
Okay.
Whether it's vaginal delivery or cesarean, we recommend 6 weeks. That's our recommendation. Okay. But of course, some people will want to wait longer, and others would want to start earlier, depending on how they feel.
Sure.
But for us as medical workers, we think and believe that after 6 weeks or 42 days, you're ready for intercourse.
Well, that's when family planning comes in.
Exactly.
What are those family planning tips or methods you advise for someone after delivery that they can use? If now 6 weeks, I've seen mothers that their kids are like 3 months and they're already pregnant, and it's because they don't maybe come back for such reviews to get to know which family planning methods they need to use. Yeah.
Lucky enough, we have a wide range of methods from which to choose. We have long-term methods, we have short-term methods, depending on how many months or years you want to space your children. So usually we recommend methods which will not interfere with milk production.
Oh, yes.
And those should be non-hormonal. If you're going for hormonal methods, then you avoid combined pills, because we know there's a hormone called estrogen which tampers with milk production. So we advise, if you have to go for pills, which is a short-term method, you choose what we call progesterone-only pills. Other people call it mini pills.
Okay.
Then for those who can, we advise they go for long-term methods. Long-term methods, some of them are hormonal, others are non-hormonal. Of course, you assess the person.
Okay.
It's what we call eligibility criteria for given methods. For instance, if someone has a medical condition against which you cannot give a certain method, you advise against that.
Okay.
So generally speaking, you assess client by client, then offer available options. For instance, we have non-hormonal methods like barriers, condoms, we have which are short-term. We have long-term methods like the intrauterine copper device, which is non-hormonal. Also, we have hormonal methods which can work for some, by the way. They're not always bad. They are those you assess, they don't have high blood pressure, they don't have migraine, they don't have clots, and they qualify for such method. Or they have used them before, they didn't have any side effects.
Okay.
And then they are willing to go for the same methods, which are hormonal. For instance, what we call injector plan, you give every 3 months. That's what we call implant, subdermal implant under the skin.
Okay, doctor, let's go for one short commercial break and we'll be back.
Bethany TV for health. Growing and multiplying.
Father, we thank you that as we've master joined our faith on this earth, whatever
Touching those close and beyond, the Word of God ministered. Lives changed.
Our God made a way for the children of Israel and they made it to the promised land.
the day of salvation, and today is a day of freedom for you in Jesus' name. If you believe it, say amen.
We celebrate the resurrection because Jesus is alive.
It's a brand new day. Here we go, we say it's a brand new day.
Never miss the Watoto Sunday service every Sunday, 10 to 11:30 a.m. live on Bethany TV for health. Wake up to a healthy start every morning, burning those calories. Every Friday and Saturday morning, 5:30 a.m. with RCMA. It's the body hit here on Bethany TV for health.
Even in rain time, it is not an excuse.
The Higher Life, the era of the Word Revolution, with Apostle Dr. David Kunowa and Pastor Rita Bella Kunowa of Rivers of Life Assembly International, Boston, Massachusetts, USA. Streaming every Tuesday from 8 p.m. to 9 p.m. East African Standard Time with the incorruptible, incomparable, and revolutionizing life-transforming Word of God. Only on Bethany TV for health. Are you ready for this good news? You can now watch Bethany TV on your TV, AfroMobile, and Airtel TV apps. Yes! Catch the finest programming prescription for everybody, wherever you are, whenever you are. Bethany TV for health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV for health. Bethany TV for health.
Welcome back from that short commercial break. We do apologize for the inconvenience. We believe you aren't hearing what the doctor was discussing, but we are back. My name is Dorothy. Dr. Nsenga Joseph is still with us in the studio. We're talking about postpartum care, and he has been talking, before we went for a break, he was describing some of the family planning methods that one mother or the other could use. Doctor, please, you can proceed.
Thank you very much, Dorothy. Yes, we're talking about reviews, especially when you come back when the baby is 6 weeks. Of course, I'm dwelling so much on the mother's side, but remember on the other side we have a baby who is undergoing some vaccination, but I focus more on the mother's side. So when you come for review at 6 weeks, there are options we give you in addition to doing a thorough assessment to know whether you're in a good state.
Okay.
So one of the things we offer at 6 weeks is family planning options. And I mentioned we have long-term and short-term methods, and most of them choose long-term methods. Depending on someone's medical status, some of them are not qualified for some methods because of underlying medical conditions, but if you qualify for a given method, it is offered to you there and then. We have long-term methods like IUD, which is non-hormonal, We have also long-term methods like implants, which are given under the skin on your left or non-dominant arm. Those methods are available, and some of them, they could be having some side effects which people know. There are myths and misconceptions surrounding those methods, but I can assure you that we have many clients who are on those methods, much as they have not come out to mention that they're doing well on the methods, but there are many people who are utilizing the methods that are available, and a few who get side effects and given other options are there. So don't be there and you're dying alone and you're always scared. You're like, what if I'm pregnant when the baby is 2 months, when the baby is 3 months? There are methods available. And for those who resume their periods earlier, the periods are regular, you can even go natural. We have natural family planning methods, which include calendar method. And by the way, for some mothers who are lucky, there's a method that's natural called lactation amenorrhea, whereby when you do exclusive breastfeeding, you don't get your periods for a given period of time up to 1 year. And once you're using that method, for the first 6 months, you're safe. But after 6 months, you don't be safe. Even if you don't see your periods, you need to have a backup plan.
Yes.
Thank you very much. Yeah.
Okay. Now, now that you've talked about the periods, the menstrual cycle changes. When a mother delivers, when should they expect for their cycle to be back to normal?
Yes, for a majority of the mothers who are lucky and they're doing exclusive breastfeeding, they may experience what we call lactation amenorrhea. Lactation means breastfeeding. Amenorrhea is a medical word for absence of periods. So once you have absent periods for up to 6 months because you're doing exclusive breastfeeding, it is very normal. Actually, as a matter of fact, you're safe because you may not conceive in that period of time. So for some others who are lucky, they may use that method whereby they don't see periods for over 6 months. Some people have gone up to 1 year without periods because they are practicing what we call exclusive breastfeeding. Some others who are unlucky, maybe they are not doing exclusive breastfeeding, or they are doing it, but for some reason their periods come early. We've had stories where mothers resume their periods within 28 days of delivery.
Yes.
Some mothers even call and say, I bled 2 weeks ago, I finished bleeding after delivery. Now this is a month later, I'm seeing blood. And then you ask them, how do you see this bleed? Is it excessive? Is it like your previous periods? When you probe further, they'll realize that actually these are periods starting earlier than they expected. So people get periods on different dates, so you cannot predict when someone will get their periods. So it's something that's open. There's no rule. Some people get their periods early, others get them later. By and large, after 1 year, everyone has gone back to their normal status.
Okay, thank you so much, Dr. Nsenga. There is one thing that really disturbs newborn, new mothers, or maybe second time, because every baby is different. They come in different shapes and sizes. There is that pain of the breast pain. How do mothers go about it? There is that sore pain when you're breastfeeding. I feel like this child, if she doesn't take this milk, the breast is going to burst. And I think those also includes with headaches when you breastfeed, and when their breast becomes sore and then you get headaches. Now you have to call the doctor. What are those things that someone can do to reduce that pain in the breast? Okay.
Painful breasts are caused by a number of factors. One of them is when you have improper attachment or positioning of the baby, and the baby is biting. Those gums can also hurt. So you find that mothers develop sores.
Yes.
Or cracks on the nipples. So lucky enough, we've taught people how to do proper attachment. And for those who are unfortunate enough to have those sores, there are some creams on sale that you can apply on the nipples, and then the sores are cured within a few days. That's number one cause of painful breasts and nipples. But there are those who get pain because of infection.
Okay.
Yes, when you get cracks and you're unfortunate enough, you get entry of germs or bacteria in the other tissues, then you get a condition known as mastitis. This is infection of the breasts. Now those ones, they need antibiotics and they need some or what we call painkillers. So that's another cause of breast pain.
Okay.
But there's something you specifically wanted to know, where the baby is unable to drain all the milk from the breast, and then you get what we call breast engorgement.
Oh, what is that one now?
Engorgement means that you have breast milk accumulating in your breast glands and the baby is unable to suckle it, and even there's blockage. Nothing is coming, yet the breast is getting bigger,
yes.
it's getting swollen. It's a very painful situation.
It is.
If that happens, there are things we tell you to do. Okay. One of them, if you have access to a breast pump, you can gently apply it and the milk comes out. If you can do what we call expression of breast milk using your hands, it helps that to avoid engorgement. And if you can use a hot towel to apply on the breast area, that can help the milk to be released, and then you overcome breast engorgement. Of course, some people have their traditional way of handling that.
Very
so
true.
I wouldn't go in that aspect.
Because you have had myths about them.
Yes.
Now that we have talked about breastfeeding and how painful it is, a little more, how do our spouses come into play when it comes to breastfeeding for the babies? Because I believe there are moments where you said earlier that if your spouse is not there, the baby may feel, you may get lost. But I think the men need to know that they need to be part of this as well.
Yeah, thank you very much. I think we are talking specifically about fathers. Now, fathers have a big role to play. One, I already mentioned, if the mother is stressed, she's not going to have enough breast milk. So mothers need support from the fathers.
Yes.
You have to be there to give them psychological, social, and financial support. Because these mothers need to feed well, they need to drink enough, they need to feel supported. They need to feel that you're there for them, you're supporting them. Why should you sleep for 12 hours when the mother is alone the whole night awake? You have to spare some minutes and show that you are caring. So care is important. Every woman needs care.
Doctor, men sleep now. You tell him that the kid is crying.
So the money supporters will not support us.
They may not be happy to wake them up.
It's very important for men or for fathers to show that you care and you support your wife when they are nursing their babies. Financially, psychologically, and socially. Show them that you're there. Let them feel you. Let them feel that you're there. You're together in this.
Okay.
Yeah, so it's very important for you to support as a man. And when the mother is breastfeeding, when she needs a nap, when she needs a rest, please be there to support. When they need a special type of food, which has been advised that's going to increase milk production, please provide. And of course, for those who fail to get breast milk because for reasons that, for one reason or another, we have pharmacological products that help with milk production. Galactovit, you put in water or tea and drink, then you get milk production coming in. Now, for those who fail totally, we have no option but to go for what we call formula products on the market. Yeah, but always try to breastfeed because the baby does well when they're having the natural breast milk compared to these other products in the market.
Wow, that's amazing. Well, we are not giving you these tips for you to go to a pharmacy and order for these things. Please, you need to visit your gynecologist so that they get to know and assess, because you may find you're the problem. You don't know how to, assemble the child to breastfeed, or maybe the other things that are pushing, to have this breast milk come through. Doctor, postnatal or postpartum care, why is it important?
Yeah, postpartum care is very important because when there are many things that could happen to a mother. Like I mentioned, we have a package for you. We have a package for you. We prevent and treat anemia. For those who don't know anemia, some mothers, when they lose blood during childbirth, they may have low levels of iron in their blood. Now, when you have low levels of blood, of iron in your blood, we call it anemia, and if it is severe, it is a danger, it's a killer, because you can get heart failure, for instance, if your blood levels is below 7. So there are signs that we look out for after delivery to show that this person is not having anemia. So number 2, we don't want people to just be there and they have given birth and they don't know what to do. So it's important for you to come back after delivery, for us to give you tips on how to handle your baby, to handle your spouse, and even we give you danger signs. Yeah, when you go home and you get a fever, for instance, that's a danger sign. if you go home and you get excessive bleeding
yes.
or you get abnormal discharge, or you see pus, or for those who are unfortunate to have what we call episiotomy tears and they're stitched. So all those things. Also, we have mothers who are unfortunate to have what we call complications, like fistula, where they have leakage of urine.
Yes.
So when these things happen, you may not know, but when you come for checkup, we can know and tell you before danger takes over. We tell you, no, this one is not good. We need to rectify this. You have contracted malaria. You need to be treated quickly. You have gotten an infection in your breast, or the baby is not doing well, or important, like you said, if somebody has maternal postpartum depression and they don't know, and you interact with the mother, you can discover before the mother gets injured.
Yes.
So it's important for mothers to come back, especially in the first 6 weeks, 3 times.
Okay.
Yeah.
So, doctor, you've spoken about diet and dieting. What do we need? You know, after birth, the first place I want to think about is the first food.
Yeah.
Because I've been missing them, depending on what I've been craving. But you find like most people, when they are done, they would order for whatever they want because they're like, I'm done. But those, some fats at the same time that affect, you know, for mothers not to have the breast milk come through for their children. What are those foods that a mother should have while they are breastfeeding?
Yeah. Now, feeding after giving birth, there are things you're looking out for. One, you want to look at foods which will promote milk production. You want to look at the types of food that will give you, will increase your levels of blood because you've lost some blood.
Very true.
And also you want to get energy-giving foods. So you need to focus on, and also drinking is important.
Which drinking, doctor?
You need to take plenty of porridge, water, juices. You have to be rehydrated. You have to take at least 3 liters of drinks a day to be rehydrated, because I'm sure there's a connection between drinking and milk production.
Sure.
Yeah, so, but in terms of foodstuffs, you need to look at the balanced diet. And you focus more on vegetables, you focus on fruits, you focus on energy-giving foods, so that you have a balanced diet and the baby can also get enough milk production. So, and also importantly, there are foods you should avoid if you know if you know that if you eat this food type, you're going to get constipation. Why on earth would you want to have constipation after delivery? You've had stitches down there and having constipation.
Yes.
So if you know that for you, if you eat bread, you get constipation. Chapatis, avoid. So people are different.
Sure.
You should learn your body and listen to your body. If you know in the past you ate chapatis and you got constipation, then avoid chapatis. Yes, so you should listen to your body, but importantly, try to have a balanced diet. Avoid the junk, avoid too much fats, and of course, you want to shed off the other excess weight you obtain when you're pregnant. So you don't want to eat junk and you start getting bigger and bigger. So you want to shed off and get back in shape, getting back your groove. That's what people say.
The groove, eh?
Yes.
You're still watching Health and Wellness, Bethany TV. For Health, Dorothy is my name. Dr. Singh in the studio. We have said, as immediately you've just given birth, please go back to eating balanced diet, greens, fruits, and making sure that you avoid fast foods like chapati, chips, pizza. You know all the fast foods we're talking about. But doctor, there are women, me I see, like after 6 months, I think, 4, they are hitting the gym. You're like, but really, is it, when do you doctors or gynecologists advise women to go back to shape and start working out? I think it also plays well for the postpartum care.
Yes. Within a few hours, if you're stable, you've given birth, you haven't bled a lot, you're strong, we say start exercise by walking.
Okay.
We call it early ambulation. Why? If you do early exercise, you avoid clots, for instance, as one example. And walking, you heal faster because there's a way blood flow is improved in many parts where there's danger or damage or tissue damage. So we advise to start exercise early, but the thing is, what kind of exercise?
Sure.
So you don't go back to the gym immediately and start lifting weights, you start jogging, jumping ropes. No, you want to start slowly. You have, again, the key message is listen to your body. If you want to start running and you run for a few meters and you're fainting, you can't breathe, what are you doing? Listen to your body. Do as much as the body can afford. If you can start walking, then you start running, then you start Kegel, of course, exercise, then you do sit-ups, then you do jumping the rope. Then eventually, as your body gets back in shape, as you feel your body, you can eventually go back to the intensive physical activities. But you have to start slowly, listen to your body, make sure what you do you can manage. You're not running out of breath, your heartbeat is okay. So the important thing is to listen to your body, but it's important to start exercise early.
Early, wow. So we shouldn't get worried.
No, there's no worry if you do exercise. Actually, there are benefits to doing exercise in terms of healing and getting back in shape.
There are mothers out there that get cesarean, as we said earlier, and there are things that they are told not to do because of, certain, they could cause more damage, to the wound. I know they need more relaxing and that. But there are those that feel like, no, they can do it. And before you know it, they are back in hospital. What are those things that a cesarean mother should avoid, especially when they are told now to go back home?
Yeah, you're talking about the don'ts. After cesarean. Of course, the key message is you don't bite bigger than what you can swallow. So if you're a cesarean mother, for instance, you've gone home after 3 days and you're going to be bending to do stuff and you're injuring your wound, it's not good. If you're going to go to the garden, for instance, you're going to be exposed to the germs, you have to avoid those things. So you have to listen to your body, don't do so much, don't strain yourself, don't stretch your body, don't bend, don't hurt yourself. The important thing here is don't do anything that can damage your wound because you delay healing. Drink enough. People fear taking juice after Caesar, and I always wonder why. Juice is vitamin C, it promotes healing. For me, I tell them, take juice. It doesn't do any harm. So avoid anything that can hurt you after cesarean. And make sure your wound is kept clean. For us, we prefer it's covered for 7 days. Now, when 7 days elapse, you remove the plaster and immediately you cleanse with either salt water or or what we call surgical spirit that can kill germs. And we advise you to continue caring for this wound. If you can clean it 3 times a day, you help us a lot. You overcome infections or septic wounds which can be acquired from the communities. So for post-Caesar mothers, please, you have to be very careful because you want your wound to heal well without any injury or damage or infection.
Wow, thank you so much, Doctor. I've had men that complain about mood swings. That when their women give birth, mood swings. Friends that have fellow women that are friends, they'll be like, that woman, the moment she gave birth, we can't visit her. She's always unhappy because, it's her first time she's experiencing this. A lot is binding up. Is it normal? Is it something that you also as doctors?
Of course, having mood swings is not normal. Whether you're pregnant or not, you wouldn't classify it as normal. But the question is it common? I don't think it is so common.
It's not.
It's about understanding someone. Yeah, you have to be supportive. Because mood swings means they are happy 1 minute, the other minute they are sad and crying. You can't predict what you say. You say something good, they misinterpret it. You speak something, they amplify it, and then there's nothing that they appreciate about you. So those things can happen, but you have to learn how to handle the situation. Don't run away. Be supportive, understand, try to be there. Sometimes you find that the mood swings will not be there anymore. Well, thank you so much, Doctor. Well, if you do have questions, please drop them on our Twitter handle, that is at Bethany TV Uganda, and Facebook, Bethany TV UG. Now, Doctor, we're talking about mothers. A little more, we need to discuss about the children. They are also part of, the mother. It's a package. Now, when the children when it comes to colic, there are many things we do. We buy syrups, we Google, if that's the right word I would say. There are many things they tell us to do. But first-time mothers, I believe this is a struggle. And as postpartum care, there are those things that
a mother should prepare herself? What are those first things they should know that they should expect when they are, coming to give birth to their new babies?
Yeah, colic is a controversial topic because we don't know. Medical workers, I'll confess, sometimes we are not sure in the first place, is this colic or the baby has other issues? What if probably the baby is uncomfy, maybe the diaper is full or they're hungry? So sometimes it's very difficult to diagnose colic.
Yes.
But we think sometimes because the baby is adjusting, there's indigestion. Sometimes you see the baby wriggling and you think maybe the pain is coming from colic. For those who may not know colic, we think it's pain from the intestines.
Oh.
Because colic comes from colon, colic pain from the intestines. So, of course, we have some products on the market which have been shown to treat and help with colic.
Fairly treat.
So, once you suspect colic, but before you think it's colic, I must say, it's not always wise to make a diagnosis at home.
Very true.
You need to see a pediatrician because you may think it is colic when the baby has another complication. So it's always good if you have access to the pediatrician to always consult. If possible, you go and they check, is this colic really? What if it's something else? So we need to be careful about that. Okay. The baby may be having another issue and then for you think it is colic, by the time you go to hospital, you find the baby has another complication altogether, or baby has infection, or the cord has issues. So it's always good to always seek medical advice before you assume this is colic and you rush for Infacobonisan and those products available in the market.
Now, doctor, we're talking about children. Part of postpartum care, immunization. It's crazy. I believe nowadays there's one that doesn't make the babies cry. There's a new one, I've heard about it.
It's called baby-friendly vaccine.
Baby-friendly vaccine. Yes. How does it work?
It's available. We have it at Bethany actually. Yes. It comes at a cost.
Yes.
Yes, so it's given at about 6 weeks when you come for immunization. So it works like the other vaccines, but the way it's given. You remember the other vaccine? They give painful injections in the thigh. So this one, they just put a patch. So the baby has no pain because there's no.
Wow.
So the vaccine gets access to the baby without piercing. So it's friendly. There's no crying, there's no pain. So some others who can afford have actually gone for it. But
generally, I want you to, explain more about immunization, how important it is, because having a sick baby, yourself, you're still healing. You're not taking her or him for immunization. I think it's also another burden. I think postpartum care, it's a package, like you say. It doesn't end, from bed to rest, to spouse, to a child, to immunization, to colic, to how many years, God?
Yeah, of course, immunization is a big package. Yes. Right from the child, the baby is born. On day 0, baby receives what we call polio 0, the drop in the mouth, and they also get BCG on the right hand, the one that causes a scar.
Yes.
That's given as soon as the baby is born. And nowadays they've added hepatitis B vaccination, which is an injection on the thigh. So first day, baby is born, they get those vaccines, as well as an injection called vitamin K to prevent bleeding. It's a vitamin, not a vaccine, but it's given. So the baby receives an injection on the thigh, gets an injection on the right upper arm. So and then baby is safe now. Then after 6 weeks, the baby comes back and they're going to get more vaccination. This time they get what we call a pentavaccine on both thighs. And they get also polio 0. And also there's a new polio called injection polio vaccine, which they get. So it's a little bit traumatizing, but with counseling, I think you can cope up with this. Now, if we come in with friendly vaccines, then the better for the babies and less the pain.
And the mother, okay.
Yeah, and the mother, of course.
Something that, has always been talked about, mothers after delivering, that headache. What causes that headache?
Yeah, headache per se, when someone has headache, headache has a million causes.
Okay.
Not going to the toilet when you have constipation alone can cause headache.
Yes.
Being dehydrated alone can cause headache. If you spend a sleepless night, you can have headache.
Okay.
If you have eye problems, which you had before, you can have headache. But if you wanted to know if you have headache with no other causes, maybe you don't have any other reason why you have headache and you have headache after delivery. For those who have undergone a cesarean section, they get an injection in the back. We call it a spinal anesthesia. Now, for those who start moving early and they don't drink enough, they get what we call spinal headache.
Okay.
Now, there are mothers who get high blood pressure after delivery. Those ones, the first sign they present with is headache.
Yes.
So headache has many causes. Just spending the whole night awake, just feeling that you don't have enough support, feeling that this baby is not getting enough from you.
Milk, yes.
And other mothers feel they're not good mothers. They're not mothers enough for this baby. That alone causes headache. So headache has many causes. But if you get enough rest, you're drinking enough, you're stable, you're not stressed, you have support, you have enough food, you can overcome the challenge of headache.
Wow, thank you so much, Dr. Nsenga Joseph. I know if you're a mother out there, this has been something that has uplifted you. So don't worry, Bethany Women's Hospital has got you covered. Thank you so much, Dr. Nsenga Joseph.
You're welcome.
Would like to sign out. Make sure tomorrow you go to church. It's a Sunday. It will be the 17th of September. For me and my producer, good night.